Dr. Anita, your fertility specialist, GarbhaGudi IVF Center, Nagarbhavi branch. Many couples have a doubt that I'm having endometriosis. Will I be able to conceive normally? Or if not, will I be able to conceive through smaller treatments like ovulation induction, time intercourse, or IUI, intrauterine insemination? Yes, it is possible, not necessary that all the patients with endometriosis has to go for IVF. Like grade 1 and 2, that is mild to moderate endometriosis patients, they can go for simpler treatments provided the other things are normal. That is, the uterine lining is normal, they are having a good lining, endometrial lining, and if the ovarian reserve is normal, and if the bilateral tubal patency, fallopian tubes are not blocked, they are normal, and no such adhesions we can see, that the ovaries are not stuck to the uterus even in the ultrasound or MRI, and the male factor abnormalities, that is the semen analysis, is absolutely normal. If it is, so if this couple come under mild to moderate grade endometriosis, then we can definitely try intrauterine insemination with them. Success rate varies. Normally the success rate of IUI is around 10 to 12% with a maximum of 15% provided other parameters are normal. So in endometriosis patient, the quality of the oocytes will be little compromised and the tubal factors also will be slightly compromised. In such conditions, the success rate might become little low. That is, instead of 10 to 12%, it can become 5 to 8%. But there is still a possibility to conceive through IUI in endometriosis patient, provided, as I mentioned, other factors are normal. But if the endometriosis is grade 3 and 4, or that is severe grade, that is, if we can see a big chocolate cyst or endometriotic cyst, and if we document the ovaries are stuck, and even MRI or any other advanced testing showing adhesions, or previously patient has undergone laparoscopy with a documented adhesions inside, or the tubal patency, it is not proven. That means if there are blocked tubes, then it is better to go for IVF instead of trying or wasting time and money in intrauterine insemination. Also, if the male factor abnormalities are there associated with the endometriosis, like if they are having oligoacinoteratozoospermia or severe oligoacinoteratozoospermia, then it is better to go for IVF, because the success rate with IUI in compromised, already in endometriosis the quality is compromised. If further compromise occurs, just knowingly trying for IUI will be waste of time and money. So if we or the couples need to try IUI or smaller treatments, then it has to be mild to moderate, provided tubes are normal, ovarian reserve is good, male factor is normal, and uterine lining is not disturbed. If the endometriosis is grade 3 or grade 4, then, or with some male factor abnormalities or the tubal pathology, then it is better to go for IVF instead of wasting time in other smaller treatments. Thank you.